A virus spreading, planes grounded, trade stalling, and even sporting events cancelled. Inevitably, markets are tumbling, but the sell-off has turned into the worst week since the global financial crisis more than a decade ago. In Geneva, he should be setting up, not stripping down, but the motor show has been cancelled. 600,000 visitors and hundreds of car manufacturers told, stay at home. Fear, as much as the effects of the virus, is stalling trade and tourism and sending the markets into retreat.
In the aftermath of the coronavirus epidemic, whenever that is, experts will look to what happened on the Diamond Princess cruise ship and ask what lessons could be learned. So far, 6 people who were on board have died, including one Briton who has not yet been named, while more than 700 passengers and crew contracted COVID-19. There have been scathing reports about the quarantine measures, of officials sent to investigate as it was docked in Yokohama themselves falling ill, and of inadequate testing. This is a message from the WHO that says, wake up, get ready, this virus may be on its way and you have a duty to your citizens and to the world to be ready. Perhaps a message too to Iran, where there is concern that the numbers infected and dying are far greater than officially claimed. They have now closed the parliament, and in the Shia holy city of Qom, the centre of the outbreak, they're using what one source told us were chemical defence vehicles from the Iran-Iraq war of the 1980s, this time to disinfect against this virulent virus.
Until this moment, taking into account the previous day's numbers, 388 people have been confirmed to have COVID-19 in the country. Unfortunately, 34 people have died from this disease as of today noon.
Some sources, however, have told us that the death toll is far higher, and that is worrying. Already 97 cases have been exported from Iran to 11 countries. In the UK, where 19 people have now been confirmed with the disease, there have been warnings that if the situation worsens, mass gatherings may have to be cancelled or schools closed. Evidence from China shows that those most at risk of dying from this virus are men over the age of 80 with pre-existing health conditions. It is also the case that 80% of people will have mild or no symptoms and can recover at home. And the hope, though increasingly fragile, is that this epidemic can still be contained.
The number of countries reporting new incidents of COVID-19 continues to rise. New Zealand, Lithuania and Iceland are amongst the latest to confirm their first cases. The World Health Organization has upgraded the global risk of the virus to its highest possible level. At least 210 people are reported to have died in Iran. As authorities there try to get control of the situation, Friday prayers were cancelled for the first time in 40 years. Worldwide, there have been more than 2,500 deaths from this strain of coronavirus. Italy continues to be Europe's biggest cause for concern, with more than 650 cases. Several towns in the north of the country are still on lockdown. The United Nations says each country has to do its bit. Even North Korea is taking action. It hasn't officially reported any cases, but sources in South Korea say the virus has been detected there. Its border with China has been shut and schools are closed. North Korea's leader Kim Jong-un has reportedly told his officials to strengthen checkups and quarantine. In the United States, a third case of community contagion. The number of infections across the country has passed 50. Other countries that haven't yet had any confirmed cases of the virus are preparing, bracing themselves for what is likely the inevitable.
To try to isolate those and contain the spread. But it's becoming increasingly obvious that this is getting more and more difficult. Doctors in Daegu say they are overwhelmed by the number of patients coming forward to be treated. They're urging those with mild symptoms now to stay at home. Over 1,000 patients are currently in quarantine in the Daegu area, asking for hospital beds. And now doctors are saying, look, it's time that we treat the most critical of cases.